And latest numbers coming in from Maharashtra, 58,924 cases in the past 24 hours. 503 COVID-related deaths reported across the state. On Sunday, the state had recorded 68,631 cases. I quickly want to bring in India Today's Vidya for more on this big story. Vidya, explain the numbers. There is a lockdown in place, but do these numbers continue to worry the administration? Is there still a shortage, whether it's oxygen, medicines, any improvement in center-state coordination?
Well, it certainly is, the shortage is a big worry for Maharashtra government. They have been trying their best. Remember the Oxygen Express, that should really bring across some bit of relief to people who have been, facing the tremors of this entire pandemic for the last so many days, because of the sheer fact that then the medicines, the oxygen, all of it is not really available to each and every person. Although remember one thing, Gaurav, today the Nagpur bench of the Bombay High Court, while hearing this entire petition that it has been taking up suo moto, said very clearly that the allocation of, for example, the remdesivir was actually not being done properly by Maharashtra government. So it was critical of it. It said very clearly, pointing out the entire data, saying that say areas like Thane, which had less number of COVID patients but had more allocation of the medicine, the injection, while places like Nagpur, there were days when Nagpur did not get the medicine at all on say 13th and 18th of this month. So they are looking into all these issues since the court is really seized of the matter concerning the Nagpur the municipal corporation. It pointed out as to why this allocation was not being done properly. So certainly there is some bit of mismanagement that the court has also pointed to, but it has asked everyone, including the Maharashtra government and the union government, to say as to why the allocation is not being done properly.
Okay.
So remember, Gaurav, that there are issues involved, but at the moment, yes, there are lives at stake, and that is the reason why just about everyone is concerned, especially considering the fact that the number of deaths that has really been on a higher side every day.
Dr. Parekh, number of deaths remain a cause for serious concern across Maharashtra. But in this situation, how do you look at these numbers? There is a sharp drop of about 10,000 in the number of those who've been infected. Yet, despite the lockdown, cases remain high.
We're only catching a small fraction of the number of infections. Some models indicate we're only catching 5% of the number of people getting infected. The number of people getting infected every day may be as high as 4 to 5 million per day.
My God.
We're catching a small fraction of those.
Is that because testing needs to increase? Is that what your suggestion is?
Testing needs to increase. Everything needed to increase several months ago. It's going to be incredibly difficult, as we saw last year at the same time. It's incredibly difficult to scale these things in the middle of a surge. Of course, we have to do so. Just a little point that I want to bring up.
Yes.
We're talking about scaling vaccinations, and we're talking about the UK model and the Israel model. Both those countries had extremely tight lockdowns while they rolled out the vaccines. And many experts have acknowledged that without the lockdowns there, the vaccines alone would not have impacted the peak. We also have to remember is that this isn't a surprise. This surge was predictable, and it was predicted. We saw it unfold in several other countries. When you bring masses of people together in close proximity,
yes,
when you allow mass congregations to occur, the virus gets an opportunity to spread very efficiently from one host to several. This is basic science, basic epidemiology. It's surprising to me that people are acting surprised that this happened. It was predictable. It was predicted.
The point that you raised about a lockdown, vaccination plus lockdown, Dr. Mahajan, is that the road ahead? Because even today, when the Allahabad High Court talked about locking down across multiple cities in Uttar Pradesh, the administration said no, stronger curbs, but no lockdown. But is a lockdown, and perhaps, God forbid, a nationwide lockdown inevitable to break the chain?
See, Gaurav, with the way the disease is surging and the way that the healthcare systems are getting overwhelmed, the way the tired healthcare workers, the doctors, the nurses, the technologists are working, there is a limit to how long they can be going on. And if this surge continues at this pace, and if we don't do anything, then, they'll be held to pay. There's no other way. So a lockdown, though very, very painful, probably is the only way, because especially in this country, we are not taking responsibility individually.
Oh, absolutely.
If we could self-lock down and not congregate, I mean, I was seeing the pictures of the migrants going back in packed buses.
Yes.
I mean, that's disaster waiting to happen. These are people going from Delhi, which is in the midst of this huge surge, and going to their villages. They are going to spread it far and wide. Remember that nearly 60-70% of the disease is asymptomatic.
Yes.
The person doesn't even know. And these people are not going to be wearing masks, or there's no distance in any case.
And again, it appears no lessons learned from last year, because I was there in Anand Vihar reporting exactly the same thing last year that Tanushree Pandey and our other reporters are reporting this year. So, Dr. Parekh, whether it's at the level of the center or the states, we seem to have learned absolutely no lessons. But with the center now saying, let states also acquire 50% of the vaccines. Let them vaccinate the youngsters 18 and above starting 1st May. In your view, will that help arrest perhaps the third wave?
Absolutely. I think we need to now focus on mitigation. In this wave, we need to limit mortalities, hospitalizations. We need stringent non-pharmaceutical interventions, and we need to start scaling vaccinations. We need to do this to prevent a third wave and to save as many lives as we can right now. But that's spot on. We need to scale things out to be able to protect people in the future, and we need to put in really stringent non-pharmaceutical interventions to limit the spread. There is no question that no matter what we do today,
Yes.
the people infected today, a subset of them will get hospitalized, and very sadly, a subset of them will die. That's going to happen over the next few weeks. Every day that we don't break the chain of transmission is going to mount our suffering in the weeks to come. We can't do anything to limit the infections that have already occurred today, but we can and we must prevent future infections.
And last 30 seconds, Dr. Mahajan, then lockdown, start vaccinating perhaps from the 1st of May as quickly as possible, and arrest the third wave. Don't let the third wave be as fatal as the second wave is proving to be.
That's absolutely right, Gaurav. The third wave is generally been smaller than the second wave. And, everything which is there in our power, we must do so that, as my co-panelist has said, the effects of this huge surge are mitigated. We prevent deaths. We reduce hospital admissions. Otherwise, people will die outside hospitals unattended. And we have to be responsible citizens. Absolutely. We have to follow COVID-appropriate behavior. We have to wear the mask. How difficult is it? 1 year down the line, if we are not able to understand that, then there's disaster waiting to happen, and we will not be able to mitigate the third wave also.
Yes, unfortunately, that disaster is already unfolding in front of us. Dr. Parekh and Dr. Mahajan, many thanks for joining me. These are very sane words of advice and caution that come from the good doctors, and I sincerely hope people hear them and follow them.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.